Thank you. Thank you very much. If any of you start getting a swollen belly, joint pain, and foggy thinking, you've got gluten problems. You've ate those pastries. So just let that be a little warning. Before I retired from obstetrics, I delivered 10,860 babies. Then I got sleepy. So now I do GYN. I do complex gene analysis, like he mentioned gene analysis of individuality. We do gene analysis through Medic Detective and all extensive pathways in your body. Very, very fun stuff to do. Anybody know what gluten is? Gluten? It's a complex protein you cannot digest. Nobody can digest gluten, not one person. A very complex molecule contains a thing called proline and glutamine. We cannot break those molecules down. Impossible. Why should you live a gluten-free life? It's been associated with all kinds of diseases. Lupus, celiac disease, which I have, celiac disease. That's why I'm very passionate about it. I went to my neurologist because I was having ataxia, trouble maintaining my balance. He did all these tests. I don't know what's wrong with you. I said, I do. I showed my dad. He says, I never thought about that. So I went on a strict paleo diet, no grains of any kind, and I've marked improvement. I'll show you the case at the end of the lecture. Useless. This guy discovered zonulin, that Dr. Limerick mentioned earlier, that causes leaky gut. Useless nutrient. We lived all of our life without it. 90% of our life we've had gluten-free until we started settling down, having agriculture, fooling around grains, modifying grains. That's when we got into problems with gluten. It's a modified protein with proline and glutamine we cannot break down. We all must go through two things in our life: the pain of discipline or the pain of regret. The difference is that pain of discipline weighs ounces, the regret weighs tons. Anything you got to have in your life, you got discipline to get that thing done, including lifestyle changes require discipline. After the mirror mission, and also the element mentioned, we're a product of our genes. That's where we get our deck of cards for life, but it's not made in stone. Those genes are modified by what we expose to in our environment. It modifies genes' expression and how our life turns out. Here we are in the middle. That's our phenotype. That's what we are. We have a genotype and a phenotype. We're a phenotype. That's what we are today based on what we exposed ourselves to in the past. Whether it be caustic chemicals, like Dr. Murray mentioned, nutrition, toxins, anything, change our phenotype. And where's that occur on a daily basis, at least 3 times a day? In the gut. What we put in our mouth tells our genes how to be expressed. Be careful what you put in your mouth. What those pastries tell your genes to do. Store some fat. It said increased insulin, increased enzyme called lipoprotein lipase, which stores fat. That's what just happened to you a few minutes ago. The interaction occurs, again, intestinal permeability. The one Dr. Youssef mentioned, we all pronounced several times for him until he got it. It all controlled there. If the control is normal and very tightly fitting, you do well, state of health. Increased intestinal permeability, and look what causes it to occur. Infections, composition of the gut, that's where major defenses are gut, like Dr. Elman mentioned. Abusing antibiotics, exposure to chemicals, pollutants, and other things like GMO foods do the same thing. So if you control that traffic very tightly, zonulin controls what goes in and out of the bowel wall, normal zonulin levels. I'll show you a slide in a few minutes. Abnormal zonulin, every time you eat gluten, it increases zonulin. Change the intestinal permeability. Then we have problems. The single most important factor in turning intestinal permeability is the gut. The good bacteria in the gut. There's 1,000 to over 1,200 different kinds of bacteria in the bowel we can't even culture, but they're there for our benefit. All those things I mentioned earlier make the gut bacteria abnormal, increase intestinal permeability, and we have problems. The main function they do is affect our immune system. As the speakers earlier have mentioned, immune system is so important in fighting off disease, protect us, and defend us against organisms. But now it's broken, we mixed up the microbiota, That's what they call the gut in the gut. 100 trillion bacteria in the bowel wall controls our lives. Without that, we have infection, we have problems. Look what it does for us. Makes ATP, energy. Metabolizes sugar. Breaks down fat. Makes proteins. Stores energy. But look at our immune function. The major thing is the immune function right here. The immune function is a major factor there. It also activates a thing called AMPK. Now, what in the world is that? Adenosine monophosphate activated protein kinase. Here's what that means. We all have, every cell of our body has that enzyme, but it goes down with age. And what's that lead to? These problems. If you don't keep that activated, that's going to happen to you and every one of us. AMPK goes down, those all increase. It's resistance, sugar levels, belly fat, all going to occur. Also, it can affect your brain. Starts over here, infection of the brain here, the microglia activation, progresses through brain dysfunction, as I mentioned earlier, earlier, Parkinson's disease, Alzheimer's disease, based on what's in the gut. Hippocrates said disease begins in the gut. Look what affects it. The stuff at the top here is the good things to have around. Good things, bad things over here. Let's go back one. But look at this over on the side. If you're born by C-section, you're 3 times more likely to get type 1 diabetes and celiac disease. Why is that? The baby didn't come through the birth canal to pick up the bacteria from the mother to colonize the bowel wall. Now what they're doing is, if you have a C-section, they put sponge in the vagina, get the bacteria from the mother on the sponges, the baby comes up by C-section, wipe it all over the baby. Makes sense. We should put that bacteria back in the baby where it belongs. Look what affects the nerve at the bottom. Things we do every day. Wrong diet, antibiotics. 178 course of antibiotics wipes out your bowels for 2 years to replace the bacteria in the bowel wall with 7 days of antibiotics. 2 years to recover. Research clearly shows that. 2 years to recover. Amazing. And we have inflammation, cancer, autoimmune disease, again, based on the gut and the gut bacteria. Germ-free mouse. Look over here, how big it is. Sterile environment. Normal mouse. Same that happens to us. You can take the stool from somebody who's lean, transfer it to a fat person, and they lose weight. That's how powerful this bacteria is in our bowel. One cause of weight gain is bad bacteria in the bowel, as demonstrated by these mice. It affects the brain. Dr. Newman mentioned that earlier. What's in the gut affects the brain. Depression, anxiety, OCD, all this occur. It's an inflammatory-based problem. It's not a lack of something like Prozac. My problem with celiac disease, I have that. I have no neurological symptoms at all except ataxia. I cannot stand on one foot. I can't walk toe to heel. It's getting better. That's ataxia. That's my symptom. No bowel symptoms at all. No bloating, no diarrhea, no constipation, nothing. Perfect balance every day, but ataxia from the gut to the brain. Look what affects here. Your function of your bowels, central nervous system, autonomic nervous system, immune system. Look what it leads to down at the bottom here. All these things at the bottom. Fat storage, barrier function, low-grade inflammation, stress activity, and behavior. All response to that bacteria in the bowel. Nobody can metabolize gluten, not one person. We don't have the enzyme to digest it at all. Again, it contains proline and glutamine, and those prevent digestion, breaking that protein down. For example, look at this example here. Assume this is a string of pearls. That's the gluten molecule there. You got to break it down little pieces to get the amino acids to heal your body with. We can't break it down. Look what this fragment shows over here. This fragment here. Oh, I messed it up here. Kills off your cells. Another fragment, immune response. Another fragment, leaky gut. Who wants to eat gluten and take that chance? Nothing will happen to you. Most people, nothing happens at all. But if you're genetically susceptible to that disease, you'll get the problem. So you got disease, genetic disorder. There's two genes called the DQ2 and the DQ8 gene. Those are the ones that you have to have that disease. I'll show you a slide in just a minute. It affects 133 people in the United States. That starts Fasano's work again. It's more common than Crohn's disease, colitis, ulcerative colitis, cystic fibrosis, all combined. It's more common than those combined. A very common condition to have, but unrecognized. You see fighting in the villi, these little finger-like projections stick out the top here, the door newts down the bowel wall. Now these are gone, that's that disease. Here's a better example of it. But look how many it's silent in so many people. They have no symptoms at all, they think they're doing well, and they keep on eating gluten. But it's there, and it's going to get them sooner or later. So why take the chance? Why would you subject yourself to something like that and not know what's going to happen to you? Relatives. First year relative, 1 in 18 chance you're going to get it too. Second year relative, 1 in 24 to 1 in 39. So what's your relative doing? What's your risk involved? What advice do you need? See what you've got. 3 things required for autoimmune disease: genetic susceptibility, environmental trigger, and leaky gut, intestinal permeability. Here's a case done in 2009. These people were studied for 25 to 30 years. 39,000 people with celiac disease with total atrophy. 3,700 people with blood marks but no biopsies negative. 13,000 people with intestinal inflammation only. Look at their mortality rates. Markedly increasing all groups. Up here, 35.9% increase in mortality. But look at the inflammation only, 72%. Inflammation in the bowel wall, back to the biosis again. The microbiota in our bowel. We've got to pay attention to that. When we don't pay attention to that. Gluten sensitivity, same reaction, but no antibodies and not severe, but can still cause a problem, a major problem in your life. 4-fold increase in last 10 years or so, 50 years or so. Why is that? Oh, just more diagnosis? Not hardly. Again, Monsanto. That's Roundup. They're spraying on our crops everywhere you go. Look what it does. The death rates have increased so much. You spray the wheat with Roundup, how the death rates have increased in the last several years. Major effect on your death rate. Again, the most important factor in causing this to increase in severity is Monsanto. It's interesting, the Lori used to be from Monsanto. The Lori who used to be from Monsanto is now the food czar for Obama. Look what it does to it. Again, it changed the bacteria in the bowel wall from Roundup. Enzyme detoxification are impaired. D3, vitamin D3 is inactivation. When vitamin D3 measures 51 on a blood test, it decreases breast cancer by 83%. There's no drug that mark does that. 17 cancers go down to 51 or higher. What's your vitamin D level? You should know. If not, you need to fix it right away. It binds up the iron, the cobalt, molybdenum, all bound up, which is all kind of metabolism in your body. Artificial sweeteners does the same thing to the bacteria in the bowel wall. It screws them up, and that leads again to autoimmune diseases. Artificial sweeteners. Here's the bowel wall here. The top here, we have the cells very close together. This bonds here hold them together. That bond is regulated by zonulin, which is an increase when you eat gluten. Too much zonulin, the cells fall apart. Autoimmune disease. You get a hole down the middle of the cell. This is the bacterial cell wall called lipopolysaccharides. It goes right to your brain. Inflammation in the brain, depression, OCD. The cells are pulled apart. That's a bigger hole on this side over here. You can test for it. It's a blood test done by Cyrus Laboratories in Arizona. Do you have the polysaccharides or do you have zonulin positive? That's a major increase in intestinal permeability. Should be treated immediately. You can fix it. Might take 3 to 6 months. I've had great success doing that. I watch these go to 0 or back to normal. Again, Dr. Fasano, he's the one that discovered zonulin in the year 2000. He proved there is such a thing as leaky gut. There is intestinal permeability. He has the proof. When that goes up, you get leaky gut. Here's an example. First of all, This is not Las Vegas. What happens in Vegas stays in Vegas. What happens in the bowel doesn't stay in the bowel. It goes throughout your body. In fact, any system in your body can be affected. You said joints earlier, your brain, your heart, cardiomyopathy in the heart can occur. So look what happens here. Eat zonulin, increasing when you eat food, had gluten in it. The cells begin to spread apart. Holes in the cell. Now we get infection in the bowel wall, but these things now pass in your bloodstream throughout your entire body. Where's it going to be? You don't know where it's going to go. Again, that's based on genetic susceptibility, what's happening to you at that time. So a reaction to gluten occurs. Over here, bowel involvement. You have the gene, see that disease. Don't have the gene, but now it's called a non-gluten enteropathy. Over here, no bowel involvement, but you can still get involvement in your brain, your myelin sheath, autoimmune diseases, parietal cells, produce anemia, diabetes, low thyroid, cardiac problems, problems with your bowels again, and this can affect your brain and also your pancreas. You don't have to have, say, a disease to have a problem. These are major problems over here, major problems. I see these every day. The cardiologist or the internist says, well, you don't have, say, a disease, you tested negative. That means you don't have these other problems? I don't think so. You can have those problems. You're predisposed now to diabetes, pernicious anemia, lupus, rheumatoid arthritis, scleroderma, through thick skin, Sjögren's syndrome, dry mouth and dry eyes, MS, myelin sheath involvement, Alzheimer's, Parkinson's disease, ALS, osteoporosis, cirrhosis of the liver, and symptoms you can get from that also. Look at these symptoms. Look how fast it occurs. Within 36 hours, the bowel leaks. In 36 hours. So 36 hours from now, if you start getting a problem, you got a gluten problem. Symptoms: skin, eczema, rashes. All these things can occur. I've seen so many people over the last 40 years with these symptoms and been told, you just need to take this cream on you, rub this cream on you. All these creams they use. It's just saying, what's the cause of the problem? Where'd that problem begin? In the gut. Over here, fatigue, weight loss, failure to thrive. I've now got up at 10 kids in my practice, I see children also, with this problem. Tiny little kids, not thriving well, they have a gluten problem. It changed their life. They're growing like weeds now, having no problems at all. Children with ADHD, many saw their problem with taking with the gluten. Anxiety, depression is not a protein deficiency. They have a problem in their bowel, which is affecting their brain. Autism, all this over here, brain fog, schizophrenia, neuropathies, arthritis, all these joint problems can occur. Sinus problems, irregular periods. I see a lot of men with this problem with infertility, low sperm counts based on gluten problems, headaches, hair loss, nutrition deficiencies. But over here, you wrote these cancers. Small bowel cancer, lymphoma, melanoma, all can occur based on a gluten problem. The same slide you showed earlier. This is a normal villi again, protects our bowel wall here. We're trying to put this out and trying to save this, but now it gets infected. Leaky gut occurs, the onion goes up, these begin to open up, and what's up here in the bowel goes in your body throughout your entire body. Where it stops, nobody knows. Joints, liver, heart, brain. So now we have problems up here in our stool, microscopic holes in the bowel called leaky gut again, here through the intestinal barrier, increase later in life of diabetes, arthritis, MS, autoimmune disease. See that every single day in my practice, seems like. It's running rampant. Third leading cause of death in the United States, autoimmune diseases. We got to pay attention. Nutrition deficiency, secondary to leaky gut, increased intestinal permeability. These are all going to go down. This is going to affect everything. It's going to affect over here, low folate. Need that to make DNA, protect your body. These can occur over here. B12, vitamin D, B6, all affect how you metabolize your glucose, your thyroid, and your brain. These can occur as a consequence of those. All these diseases are associated with those nutrition deficiencies. Major problems. Again, every organ system in the body is affected there. Now, when did all this start? We now have increased gluten in the grains. In the Roman days, it's like 10 to 15%. Now it's 40% by weight is gluten. There's more gluten per gram than there used to be in the Roman days. 30 to 40%, used to be 10 to 15%. Genetic engineering, fooling around with those grains. Chromosome 16, that's where zonulin is. Look at the diseases associated with zonulin. We're talking about autoimmune diseases, cancers, nervous system. The same gene. Chromosome 16, that's where zonulin is. And that's what you find. Here's some pictures of what I see in my office on a daily basis. This person had been to the doctor about maybe 4 or 5 dermatologists and treated for the various creams and ointments. That's celiac disease. Dermatitis hepatiformis. See teeth like this on a regular basis. I listened to my one guy, he also had that, everything else was negative, except that was positive. Celiac disease. Common ulcers in the mouth, occur all the time. Over here on the other side, that's how you diagnose celiac disease. Over here, this is gluten sensitivity. The main difference is the tissue transglutaminase. The cells that line the bowel wall have this enzyme inside the cell called transglutaminase. There's 3 different types. Number 2 is for the bowel, 3 for the skin, 6 for the brain. I can do a test to see which one they've got, what part of their body's involved based on that enzyme production. When the cells are broken open, you make an antibody against that particular enzyme, and it shows up on a blood test. Called an anti-transglutaminase antibody. 2, 3, or 6. Which one do you have? Where do I need to direct my attention? Doctors here in town, where we live now, they still measure anti-gliadin antibodies. That went out about 7 years ago. Because now we have these over here on the other side. We have alpha, beta, gamma, delta. Which are all those. This can be negative over here and still have a gluten problem. You can measure that again. There's a transglutaminase. Has to be secret IgA to be positive. Zonulin again. Here's the test you need to do. But look what it costs. It's not practical. That's out of pocket. So I tell my patients, they're women, I say, just go on the grain-free diet and see how you do. Take the money and buy more shoes. Okay. If there's a man, I say, buy more Viagra. They seem to identify with that. These good cross-react gluten. They cross-react. The same symptom you're going to get with these foods, the gluten, because the same shaped molecule, the bowel can't tell where it's gluten or where it's these molecules. The same thing occurs. That's milk chocolate over on that side, instant coffee over here, not regular coffee. So a lot of people I see, they're on a grain-free diet, but they still got symptoms. They're positive here. They're eating rice and tapioca and millet and quinoa and all this stuff they're eating. They go take those out of the diet, they do much better. Treatment, only treatment you have is a grain-free diet, and that's for life. It's figured for life. You can, well, I'm just going to cheat a little bit. You'll pay the price. Been there and done that. Gluten-containing grains, ones you'd avoid there, list of them there. It's a bunch of grains. Sources of gluten. Don't forget these over here. Drink mixes, gravy, seafood, salsas, soy sauce, caramel, candies, lip gloss, chapstick, Play-Doh, envelopes. Be careful. These are grain-free, these are gluten-free grains. I prefer to go paleo myself. I don't do grains at all, because some people react to these grains also, get the same sin they do with gluten. I have no wheat, oats, barley, rye, rice, or corn, no dairy, no white potatoes, no peanuts. Peanuts are a legume, they're in the ground. Tree nuts are okay, but not peanuts. They're a legume. Also, we know that grains contain a thing called phytic acid, which binds up your copper, your zinc, your iron, your vitamin D and magnesium. All grains contain phytic acid. Safe ingredients again are here. A lot of people on a grain-free diet are deficient in calcium. I monitor that closely. I encourage patients to go dairy-free also. There's all kind of hormones in dairy, as you know, cause all kind of problems. So I'd go dairy-free. I use almond milk only. I use the Silk brand. That's the best brand out there. The hardest thing I have done is getting people to change their lifestyle. That's the most difficult thing. They want a pill, they want a prescription. They don't make those changes in their lifestyle. But if you don't, you're never going to get any better. You have to make the changes. Here's what barriers to compliance. I run these all the time. Your friends, oh, you can have a little bit of gluten, it won't hurt you. A little bit won't hurt you. It'll hurt you. You go out to eat, well, just have some cake this one time. Go to a friend's house. Oh, it's okay, just eat some gluten, you'll be problems. You have to understand, this is the problem of my life. If I don't fix it, I can't fix my life. These factors improve adherence. To me, the things educate the patient. Spend time with the patient. Explain all these things to the patient individually. What's your genetic makeup? We got to check your genetic makeup, see what you're doing. So people like test results. So I do a lot of testing to prove the point that you really have a problem. It's not just, I said so, but the TV said so. Here's the data based on your individuality. Here's a graph I made up. Look how this works. Top here, say you had the gene for gluten. These things activate the gene. I should put Obama in here too, I guess. Obama right in there. These turn the gene on. Bowel gets leaky, like you mentioned also leaky brain occurs also. Activates cortisol. What's that cause? Memory loss, thing in the skin, insomnia, weight gain, osteoporosis. All these things occur based on cortisol levels. Suppressed hormones from the brain, messed up hormones, suppresses TSH, low thyroid levels. Malabsorption, these go down. What's that lead to? Elevated homocysteine. What's that cause? Increased heart attack, stroke, and Alzheimer's. Messed up your thyroid. The good hormone, the T3 is the good hormone. That goes down. The bad one's called reverse T3, goes up. These problems occur down here. Where do you start? The conventional doctor starts down here. I start up here. We all start up here. These practitioners in this room start up here. What's the cause of the problem? Don't treat the symptom, treat the cause of the problem. It's not easy, but it's fun. It's a lot of fun. This example. I read this article on a Sunday afternoon, about 2007, I think. Yeah, 2007. This guy presents to the doctor, 44 years old, weakness in your right quadricep, hard time writing. The doctor said, well, you have Lou Gehrig's disease. There's no cure for that. Just take this pill. Another opinion. Ferritin is iron. Iron source is called ferritin. 79 for thyroid dysfunction, he's 17. Did a biopsy, had celiac disease. Look at your brain scan. Tumor up here, tumor, tumor, tumor. 2 months later, no therapy, bigger, bigger, bigger. 9 months gluten-free diet, he's normal. No chemotherapy, no surgery. Going off the next day, first patient I see the next day comes in, she's a young girl, 36 years old, scheduled for brain surgery. Her test came back probably that day was celiac disease. I said, cancel your surgery. That's more than a chance. That changed her life. We both cried. So I got thinking, maybe he had celiac disease also. Nobody recognized it. Lou Gehrig, Wheaties box. Maybe that's his problem. These books are great books. This one coming out soon, The Brain Maker. It's all about the gut and effect on the brain. They're great books. This one, Dr. Pistano just wrote recently. Read that one also. Thank you.
Hi. I went through many conventional doctors, my GP, who really couldn't figure out what was wrong, then I referred myself to Mayo Clinic, and they really didn't come up with the diagnosis that solved my symptoms. And I knew that I was going to figure it out one way or another, that I wasn't going to accept that I had a condition that there was nothing they could do about. I got assigned to Shands in Gainesville and had the same results, that they were not coming up with what was my root cause of my issue. Dr. Hall in Ocala, Florida, was able to diagnose what my issues were, and my symptoms have now been alleviated. He is a brilliant doctor and one who has a very caring heart. Love Dr. Hall.
Hi, I just wanted to talk about Dr. Hall, who is one of the speakers at today's seminar. And I have been a patient of Dr. Hall's for going on 5 years now. Dr. Hall has been a key player in changing my life. He diagnosed me with gluten intolerance, and I cleared up after 2 years. We had to work hard on it together with testing procedures and different therapies, but I finally have healed my leaky gut syndrome, and I have lost 85 pounds in the process. And changed my life around. I no longer have depression and anxiety. I no longer have pre-diabetes, and it's just really changed my life around. I highly recommend him to anybody who needs help.